Welcome to another episode from the Veterinary Research Channel. Today, we're diving deep into a fascinating study on Pancarpal Arthrodesis, or PCA, in dogs, a procedure that might sound complex, but we'll break it down together. This research, which appeared in the Journal of the American Animal Hospital Association, explores a specific surgical technique and its outcomes, offering valuable insights for pet owners and veterinary professionals alike. So, what is pancarpal arthrodesis? Imagine your wrist, but for a dog. The carpus is that collection of small bones that allows your dog's foreleg to flex and extend. When these joints are severely damaged due to injury, arthritis, or other conditions and no longer respond to conservative treatments, PCA becomes a salvage procedure, essentially fusing those carpal joints to eliminate movement and, hopefully, pain. This particular study focuses on a method using orthogonal, meaning perpendicular, bone plates to stabilize the carpus during this fusion. Think of it like reinforcing a structure with supports running in different directions for maximum stability. What makes this study particularly interesting is that the researchers did not use rigid external coaptation, like a cast after surgery. This is a notable departure from traditional methods, which often involve weeks of cast application. The study aims to evaluate both short and long-term outcomes, the progression of arthrodesis, and any complications that might arise. Study design and methods. Let's delve into how the study was conducted. The researchers meticulously reviewed the records of dogs who underwent PCA at a single veterinary referral hospital between 2015 and 2022. To be included, each dog had to have undergone unilateral PCA, stabilized with orthogonal plating, and without rigid external coaptation postoperatively, with at least 8 months of follow-up. The surgeries were performed by board-certified surgeons or small animal surgical residents under direct supervision. The data collected was comprehensive. It included the dog's breed, age, weight, sex, the reason for the arthrodesis, the types of implants used, any complications during or after surgery, and of course, the clinical outcome. Postoperative radiographs, or X-rays, were examined to look for signs of bone healing, any loosening of screws, implant breakage, or other potential issues. To assess the long-term success of the procedure, the team relied on owner questionnaires, specifically the Canine Brief Pain Inventory, or CBPI. This tool allowed owners to subjectively assess their dog's pain levels and functional abilities well after the surgery. During the procedure, each dog was administered cefuroxime, non-steroidal anti-inflammatories, methadone, and general anesthesia. In terms of the surgical procedure, the dog was positioned in dorsal recumbency, and a craniomedial approach was taken to access the distal radius, carpus, and metacarpal bones. The cephalic vein was preserved where possible, and the abductor pollicis longus tendon was cut to allow application of the cranial or dorsal plate. The tendon was reattached after plate application when possible. The carpus was maintained in approximately 10 to 12 degrees of extension via contouring of the cranial or dorsal plate, which was then secured to the radiocarpal bone, distal radius, and third metacarpal bone, with one screw in each segment. The plate and screws were then removed and all ligaments and soft tissues were debrided from the antebrachiocarpal, middle carpal, and carpometacarpal joints. Articular cartilage was then removed with a pneumatic high-speed burr, and lavage with sterile saline was performed. The arthrodesis sites were packed with either autogenous or allograft bone graft, and the cranial plate was reapplied with the remaining screws. The medial styloid process and medial aspect of the base of the metacarpal bone too were removed using a pneumatic high-speed burr or oscillating saw, such that the medial surface was flat. A medial plate, spanning from the distal radius to the proximal aspect of the metacarpal bone too, was then secured using appropriately sized screws. Postoperative management included a modified Robert Jones dressing to control swelling and postoperative analgesia. The duration of the dressing ranged from 24 hours to 7 days. Key findings. So, what did the study reveal? 21 dogs met the criteria for inclusion. The most common breeds were English Springer Spaniels and Collie crossbreeds. The average weight was 23.2 kilograms, and the average age was 3.9 years. The most common reason for PCA was hyperextension injury, accounting for nearly 62% of the cases. The researchers tracked several key outcomes. They looked at lameness scores, radiographic evidence of bone fusion, and any complications that arose. They classified complications as minor, major, or catastrophic, based on the level of intervention required. Surgical site infections were further categorized as deep or superficial. One notable finding was that only a small percentage of dogs, about 14%, required a revision surgery. Some dogs experienced surgical site infections, but most were superficial and resolved with medical management. The long-term results, as reported by owners, were encouraging. The average pain score indicated no to mild pain, and the average functional score was classified as very good. Most owners rated their dog's overall outcome as either excellent or good. Interpreting the results. What do these findings mean in the real world? The study suggests that orthogonal plating is a viable technique for pancarpal arthrodesis in dogs. The fact that the researchers did not use rigid external coaptation postoperatively is significant, as it potentially reduces the risk of complications associated with casts, such as soft tissue injuries. The authors compared their findings to previous studies. They noted that while their major complication rate was similar to some studies, differences in how complications were classified made direct comparisons challenging. For example, some studies classified surgical site infections that resolved with oral antibiotics as minor complications, while this study classified them as major. The researchers also discussed the biomechanical advantages of medial plating. Placing a plate on the medial, or inner, aspect of the carpus offers good resistance to bending forces and requires less soft tissue dissection compared to other approaches. Potential complications. There are potential complications that can arise from the procedure. One dog in the study experienced an intraoperative complication where the screw had sheared off. The authors believe that the screw had sheared off secondary to the torque used when placing the screw, which is more likely with smaller screws, self-tapping screws, and traversing through multiple cortices. It is recommended to tap the drill hole before small diameter screws are placed. Another potential complication is fractures of the metacarpal bone 3 due to the creation of a stress riser. The authors theorized that medial plate application reduces the risk of a stress riser on metacarpal bone 3 compared with standard cranial or dorsal plating. Considerations and limitations. Like all research, this study has some limitations to keep in mind. The retrospective design means that the researchers were looking back at existing data, which can introduce biases. Also, not all dogs had long-term follow-up, and the outcome measures relied on subjective owner assessments. The relatively small sample size and the lack of a control group also limit the conclusions that can be drawn. Despite these limitations, this study makes a valuable contribution to the field of veterinary surgery. It provides evidence that orthogonal plating, without rigid external coaptation, can be a successful option for pancarpal arthrodesis in dogs. Clinical significance. The study's findings have several important implications for clinical practice. First, they offer an alternative to traditional methods that rely on postoperative casting. Second, they highlight the importance of careful surgical technique and appropriate implant selection to minimize complications. Finally, they underscore the value of long-term follow-up and owner involvement in assessing the success of the procedure. In conclusion, this study provides valuable insights into the use of orthogonal plating for pancarpal arthrodesis in dogs. While further research is always needed, the results suggest that this technique can lead to good long-term outcomes in terms of pain relief and limb function. Thank you for listening to the Veterinary Research Channel. A link for the referenced paper is in the video description. Remember to test your knowledge by answering the questions in the description, and as always, keep those minds inspired, hearts light, and tails wagging.